Please tell us who you are, what you do, who you serve.
Absolutely. So my name is Cheryl Reilly. I'm a licensed clinical social worker, and I have a private practice here in Austin, Texas. I specialize in maternal mental health. So I work with generally new moms with anxiety, depression, maybe have experienced infertility or loss. And that's who I talk to all day long.
Okay. So the topic of this article is perinatal mental health and kind of the basics, kind of the stuff that maybe everybody should know about. So to start, what exactly does perinatal mean? So what are we talking about when we say perinatal mental health?
Yeah, it's such a good question because we kind of use it flippantly and don't always describe what it is. So when we are talking about perinatal, especially in mental health, we are talking about pregnancy through the first year postpartum. So anything that happens once you get pregnant to that first year of the baby's life, we're going to put it in that perinatal category.
Okay, good to know. And so we do know that there can be issues with mental health, before pregnancy, like you said, during the, any kind of like an infertility kind of journey, and pregnancy can have its own set of issues. As far as what we're talking about today, I kind of wanted to focus in on the postpartum period because I think that's what most people think about, have concerns about when they're thinking of getting pregnant or are pregnant, because we hear about this sometimes, right? We hear about it maybe from family and friends, but we hear about it in the media. And so giving that the focus today. So first, I know that everybody can probably expect some level of change in our moods, in our emotional state, our mental health, right after having a baby. Would you say that's true? And what exactly does that look like? What is normal?
Definitely. I think you've gone through this pregnancy, whatever happened before that, and now the baby comes, and it is just a flood of emotions and changes and transitions in your life. So I would say what normal looks like is, yeah, we're going to have some tearfulness. We're going to have some feelings of overwhelm. We're going to be tired. But none of those things are disrupting our day-to-day life. We're still able to do things. We just might have some mood swings here and there, but certainly nothing very dramatic.
Okay. And is it all bad 100% of the time?
It's not all bad. We can definitely have those moments of joy and elation and like relief that that baby is finally here and all the things that we have gone through and worked so hard to get here. And so, yes, it can definitely be ups and downs, but we kind of are in that normal period, want to see gentle ups and downs where that is normally expected and not just like up, down, up, down.
Okay. Because so what you're saying is with a mood disorder, with like a more problematic situation, people can also have some ups and downs, but they're just more intense.
Exactly. Right. And so once we get into that mood disorder category, we are looking at more extreme up and downs. They might happen quickly, or you might be stuck in one of them longer than the other. But just not returning to baseline as you normally would in life. Like something has changed and this is not your norm.
Okay. All right. So with those normal ups and downs, some people refer to it as the baby blues, right? Those that time. How long do you expect for that to go on?
Yeah, that's another great question. So we typically see baby blues peaking about day 3 postpartum and resolving around the 2-week mark. So 3 days to 14 days. Yes, you might have these ups and downs, tearfulness, overwhelm, also the happiness and joy. And then it calms down after that.
Okay. So 2 weeks can feel like a long time.
Mm-hmm.
Do you have any recommendations for how people can kind of ease through that a little more gracefully? Maybe any tips for helping?
Definitely. I would say, first of all, give yourself some grace. This is a very big transition that you are going through. And so, not something that we would expect you to just be like, okay, now I have a baby and everything is, going along perfectly. You are going to be tired. Give yourself some grace. You might be forgetful. That's okay. And then also, if you have a support system that is willing to help you and they are offering, let them help you. If someone's offering to bring you dinner, let them bring you dinner. If they're offering to hold the baby so you can go take a nap or a shower, go take the nap or the shower. There is nothing wrong with that. And the more you take care of yourself, the better you're going to be able to function as we get through those 2 weeks and longer. Don't stop at the 2 weeks, but
Yeah. Yeah. You need to put that oxygen mask on every once in a while.
Mhm.
That period of my life was definitely a lesson in accepting help. And I'm very glad for it now. But for sure, it was a little bit humbling. But once that was done, it was wonderful. And I know I love helping people that I love. So
Exactly. People want to help you. And if you don't accept it, they're like, well, okay. I did read this really good idea one time where they were talking about while you're still pregnant to write down things that other people can do in your house and then like put them in a little jar. And then after you have the baby or somebody texts you and says, hey, what can I do? You can take that little piece of paper out and it's like, fold the laundry. Well, you can fold the laundry. You know what I mean? Or you can do the dishes or you can vacuum. But there are plenty of things that people can do. And often when you're in that space of overwhelm and trying to do everything yourself, you don't think of these little things that people can do to help. And really, I would vacuum anyone's house if that's what they needed. Okay.
yeah, I actually love vacuuming,
It's
especially
very
if it's not my house.
satisfying.
Yeah. Yeah.
Yes.
Absolutely. I love that idea. I have not heard that idea. I've got other ones that I recommend, but I have not heard that one and I love it. I also it's a book or a program. I can't even remember the name of it. I wish I did, but it's something like Seven Sisters but the basic idea, and I would hate to, I want to give them credit because it's a great idea, but it has something to do with basically assigning a person for a day of the week. So if you've got 7 people, right? So you have a Monday person and a Tuesday person and a Wednesday person. Then for those few weeks that you're in this postpartum recovery, you have your Monday person there on Mondays, helping you with whatever you need done on Mondays. Or even if you don't have like pressing needs, but just
Yeah.
someone there to be with you, to talk,
Mhm.
make you feel like, it's a little bit closer to normal. And I love that idea. I'm going to have to go look it up.
That's a good one.
Okay, so great ideas there. I think you also mentioned something we were talking earlier about, like more physiological ways of helping. So you're asking for help, you're getting support to help you ease through this time. But what about some other things?
I think, taking that time for you is really important and that self-care. So get that shower in, eat food that's still warm, and allow, again, just like give yourself some grace on that.
Yeah. And I know you said sleep was really high on the list of priorities. That can make a huge difference, right?
Sleep makes a big difference. And in my practice, when I see clients and they're telling me how much sleep they're getting or not getting, um, we almost always see an improvement in their symptoms once they are getting more sleep. So it's either that we have protected their sleep and come up with a plan for how to do that, or their baby just starts sleeping a little longer. So they're getting longer stretches of sleep. But we can almost always see a difference once that sleep is just a little bit better.
Yeah. Okay, well, how about, because you know where I work, right? I work for Breastfeeding Success. How about breastfeeding? Where does that come into the picture where all this is concerned? And can it have any effect on a person's mental health?
Absolutely. We have a ton of research that shows breastfeeding can have a positive effect on mental health, and it can be very protective, and all of the hormones and things that are going through your body can help you sleep a little better, just you're feeling good about feeding your baby. So we know that there's information that says that. We also know from experience that if those things are not happening for you and you are doing everything that you can to maybe solely breastfeed this baby, that can be detrimental to your mental health. So if you're feeling frustrated and overwhelmed and like you're constantly failing at this thing that your body should naturally do, then that's when we're like, okay, let's take a step back. Let's see what we're dealing with here. And like, what can we figure out to kind of meet your goals as far as how you want to feed this baby, but also take care of yourself so that we're not getting into this space of like, I'm failing at being a mom.
Yeah. And I mean, we see people all the time who are in this situation, as our lactation team that works in the outpatient clinic. Um, and I think what a lot of people have in the back of their mind is, I either breastfeed and I'm all in there, or my only alternative is to formula feed from a bottle. And that's not true, right? There are so many alternatives. There's a lot of gray area. And so it can be very comforting to go visit with a lactation consultant.
Mhm.
Tell them what your needs are, what your goals are, and they might be able to help you find some kind of middle ground that preserves both, right? In some way. Yeah,
Exactly.
that
Yeah,
is.
if we can figure out how to, yeah, meet your goal, make sure the baby's fed, and release some of the guilt around whatever is happening. That's a big part of it. I know when I'm working with clients, I almost always ask them what their goal is. And I'm not a lactation consultant, but I know that if they have a goal of breastfeeding for 2 years and we're at month 2 and they're on the struggle bus, I know we're going to have to do some work on that. Like, this 2 years is a really long time for you to be in this place. So it's just a matter of figuring out, like, how can we adjust so that everybody's needs are being met.
Hmm. Oh, and my favorite thing to remind people about is that breastfeeding a newborn is very different from breastfeeding a 6-month-old or a 9-month-old or a 1-year-old, right? They change so much, it won't be the same in a
Right.
few months, or even maybe in a few days or weeks, right? So to
Mhm.
kind of this constant reminder, like, this is temporary, this is
Yeah,
temporary, but of course get help too,
right.
because not everything is temporary. There's some
Right.
things you might need real help with.
Exactly.
Yeah.
Mhm.
Okay, that's all very good. Um, and now, kind of getting into the stuff that's not so normal, because everything here to this point really has been, this is the stuff that pretty much everybody's going to go through. We're all going to have a few ups and downs and some struggles during those first couple of weeks. But, now venturing into the abnormal territory. Like, so what kinds of things are not normal?
Right. So before, when I was saying normal, that we have our ups and downs, but you can kind of return to baseline pretty easily, how you normally would react to a situation. When things are not normal, or what we would consider a disorder, a general rule of thumb is, if if your symptom, if your anxiety or depression is negatively impacting your life for about 2 weeks or more, it's probably time to talk to somebody about that. Mention it to your partner, mention it to your doctor. Um, but being aware of it and recognizing, like, okay, I'm actually not doing things I would normally do, or I'm crying a lot more than I would have expected of myself, or I'm so worried all of the time, that I can't even get other things done because I'm forgetful. So all of those things, when they're impacting daily life, a day or two here because you're tired, okay, I'm going to give you that because you have a newborn. But if that's extending and it's really impacting, then that's when we're like, this might not be in the realm of normal anymore.
Okay. So what kinds of disorders do you typically work with? Like, what are the more common things you see?
Yes. I actually see a lot of anxiety, definitely more anxiety than depression. Depression is out there. We screen for it and we look for it because we know that it has impact on both mom, relationship, the baby, etc. But so does the anxiety, and we're not as great at screening for that. So I tend to see a lot of anxiety, but in general, anxiety and depression are the top disorders that we see in the perinatal period.
Okay. So what would be maybe some of the hallmark things for depression? Like what kinds of things do you look for there?
With depression, we're looking for the typical things that you think about. So tearful, crying a lot, overwhelmed, maybe sleeping a lot more than normal. Insomnia can come about. Eating changes. Sometimes it's not eating as much, sometimes it's eating more than we normally would. Um, and just you might be getting daily activities of living done. You might be showering, you might be eating, but it's taking you so much energy to do it. And you have to talk yourself into it. You're like, I know I need to shower. I know I need to shower. Whereas normally you would just get up and shower and it's not a big deal. So again, when it's different from normal for you and it's impacting your day-to-day life, those are the hallmark signs of depression that we're looking for.
Okay. And so does anxiety look different from that? So when you're seeing people with anxiety?
Anxiety does look different because our anxiety is really motivating to make sure that we get all of these things done. Your anxiety doesn't want to let you not shower, not eat, not feed the baby, not change the baby, right? Your anxiety is telling you, like, do this, do this, do that, do that. And so often with anxiety, we're definitely seeing all of those things get done. And I think that's why it's probably underdiagnosed, because moms with anxiety are very functional. They are doing all of the things. They're going out. They're just everything's getting done, but it is exhausting. And then they're in their head worrying and, constantly just thinking about, what do I need to do next? Or what happens if this happens? And so it is very exhausting.
Okay. And I know you mentioned something about intrusive thoughts some earlier when we were talking, and I know that that's something that comes up a lot with anxiety, right?
Definitely.
Maybe depression too. I don't know, but
Yeah, I would say it probably comes up with depression, but maybe more so in anxiety, just because it's like this thought. The common one that we were talking about is, I'm going to fall down the stairs with my baby. And some people just have the thought, some people can like visualize it, and it's just this passing thought. It's not going to happen because you're being so cautious and holding onto the rails and holding onto the baby, but you still just have that moment of like, oh my gosh, we're gonna go down. So yeah, intrusive thoughts are a hallmark of postpartum anxiety for sure.
but that's a thought that keeps coming back. It's almost
Yeah,
like gets obsessive even. Like,
for sure. So it doesn't matter how many times you go up and down those stairs and everything goes fine, you still have that thought. And sometimes you'll like see a set of stairs and have that happen again. So it's not going to happen, but you can't seem to stop it. That's when you're like, maybe something's going on here that I should probably talk about.
because I mean, it's pretty normal for a new parent to worry about things like that sometimes, right? Like we think about tripping and falling and while we're holding the baby, or I'm stirring a pot of soup on the stove and oh my gosh, I'm holding my baby, but what if their foot went in there and I burned the baby?
Mm-hmm.
So it's very normal for a new parent to have those thoughts, but they're not like recurring thoughts that keep coming back and then we start behaving differently because of this thought. And
Mm-hmm.
so those are different, right? So one is normal, one is not.
Right.
Okay.
And that's where I talk a lot about anxiety being protective. Like there is a section of anxiety that you have that keeps you and the baby safe. And that's great. Right. And that's in the realm of normal. Once it becomes like an obsessive thought, or like you were saying, you change your behavior because of it, that's when we're getting into that disorder part. If I'm avoiding stairs or I'm avoiding cooking, Like I'm not even going to cook because I'm too afraid that this is going to happen. Okay, well, that's probably not sustainable.
Yeah.
Mm.
Okay. Good to know. And so, what next? So, let's say you might suspect that something's going on, or you suspect this for a loved one.
Mhm.
How do people get help for a suspected mood disorder?
Yes. In an ideal world, you would, just like you would have like your pediatrician picked out, your lactation consultant picked out, your OB picked out, you would have a therapist picked out. That's not generally on most people's like things to do before I have this baby list. But if it is, you can call your therapist. If you don't have that yet, and you have a doula, a lactation consultant, your OBGYN, your pediatrician might have some recommendations. So any of your providers that are kind of in this birthing world generally are good about saying, okay, like, yeah, let's get you connected with a therapist or a support group or a group therapy situation. We have a lot of options. Let's see what's going to fit best for you.
Okay. I know you mentioned that doulas have been a great referral source, that you see that families come to you often because their doula spotted something and recommended they get help. I
Yes.
love that. I love that people are having doulas because I
Yes.
agree. Yeah, doulas are fantastic.
They are great. They have a really good relationship with the family, and often they have met the family beforehand, so they have seen a baseline, and then they'll usually, see them during and after, and so they'll see if something changes, and they're very good about having a compassionate conversation about like, I've heard you say some things, I've heard you or I've seen you do some things. Have you ever thought about therapy or, is this something that's even on your radar?
Yeah. Okay. And then you mentioned a couple of things before when we were chatting about trusting your instincts. And then the flip side of that.
Mhm.
So there's people like in two different camps. So can you kind of explain that?
Yeah. So I think the two camps are, I think something's wrong. I am going to seek out some help. Or you have a loved one or a doula or, somebody in your support system that kind of tries to gently tell you that maybe they're seeing something. And maybe some people hear that, maybe some people don't. you know? So I think if you don't necessarily have to know exactly what you have to call your provider. You don't have to say, I'm experiencing 4 out of the 6 symptoms of anxiety. I need to see a therapist. You can just have a feeling that something is not right. I don't think I'm supposed to feel like this long, or I don't feel like I'm bonding with the baby that the way I'm supposed to. I don't feel like this transition is going in the way that I thought it was going to. All of those are valid reasons. If someone called me or sent me an email and said, I just don't feel like I'm bonding with the baby. Okay, let's talk about that. And then, yeah, the other camp is someone in your support system kindly mentions to you that maybe you want to reach out. And if you can take that without offense and really be able to take a step back and be like, okay, they might be right. I have said some of those things. Maybe I should just talk to somebody and see what they think. Let's get a professional opinion. And if they're like, yeah, that's normal, great. Then now you know. And if the therapist or the provider is like, I think maybe we could probably work on this, make it not so hard for you right now, then great, you found a provider.
Yeah. Well, can you offer some advice maybe for loved ones, for anyone who might be trying to um, sort of who has recognized that their loved one might be suffering from a mood disorder and wants to tell them, but they know it might be hard to hear? Like,
Right.
do you have some recommendations for how they might go about that?
I really think if you can come at it from a place of love and like caring, it makes a difference on how it's going to land with that person. So if my partner came to me and said, hey, I know you really well, and I'm a little concerned for you. I feel like something's not right. Can we talk about it? That is going to land much better with me than if my partner came up to me and was like, why are you acting like this? I don't like this. I don't like what's happening here. Get yourself together, snap out of it.
You need therapy.
You need therapy, right? Like that's probably not going to land as well. And then as the partner, the support person, recognizing like they might not take that information. They might not be ready for it. They might not want to hear it. And you might just be planting the seed. But I would rather you plant the seed than ignore it, because they, if you recognize it and acknowledge it, they might start to pick up on some of those things that you were seeing. And then one of the other things that we were talking about beforehand was, again, in an ideal world, if we could talk about these things before they happen and say, I'm worried that I'm going to have some anxiety. If you see me doing this, if you hear me doing that, please mention it, and I will take that to heart and do something with it. And that way you've already had the conversation. We're not being accusatory. It's just, again, it's coming from a place of love.
Yeah. I know that sometimes the symptoms of anxiety and depression can include irritability, right? And so sometimes that's hard for partners to want to approach us if we're extra irritable. And also if we're extra irritable, it's extra hard to hear things like that and respond well. So I love this idea. Kind of setting up a game plan while you're still pregnant. Like, okay, I understand that there might, that postpartum depression, postpartum anxiety are real things. Hopefully, that's not going to be my experience. But if it is, let's talk about ways that you might be able to point it out to me, because we know that a lot of times the person who is having the mood disorder is the last one to recognize it in some cases, not in all cases, but sometimes, right? Other people see it before they do sometimes. So I love that idea. I love that idea so much.
When I was working in the hospital system, I was a social worker, and we would get a referral for a patient who maybe has a history of depression. So we know they're at higher risk of postpartum depression. And part of the problem with that symptom or that system is that we're going in on day 2 and talking about postpartum depression, which is no one's listening because they just had a baby. But I would always make sure that they had a partner or support person or someone there when I was in there, because I knew that mom or the birthing person was not listening to me. But if the partner or the support person was there, and I could be like, if you see this, this, and this, and these symptoms, you're in charge, of bringing it up. And that was always, I think it was just an interesting approach, because again, like we were talking about it way too soon, but that's the only time that I have access to them to bring it up. And so to have that person who's kind of on the outside who can see, I know what normal is for this person, and I know what might look abnormal. So I'm going to be aware of that.
Yeah, that's great advice. Okay, and so you've mentioned already, if someone suspects and they reach out to their support system for some referrals, for some help, you mentioned things like support groups and group therapy, parenting groups, individual therapy. And so that's kind of what you do, right? So you provide those kinds of services.
Mm-hmm.
That's correct. And when is it that you're usually seeing people? When do people usually approach you for help?
Yeah, by the time they make it to me, because they've probably been showing symptoms for a little bit, their partner or somebody has recognized it and they talk to the doula, the doctor, someone else, I would say it's usually around the 3 to 6 month mark. We have some bigger transitions that are happening around then. Mom might be going back to work, dad might be going back to work. The baby's changing so rapidly in those first 3 months. And then you get to this point where there's a little bit more of a routine and we can take a deep breath and be like, okay, I'm not in crisis mode anymore. So I think I can take care of whatever this is over here. So I would say by the time they get to me, it's usually around that 3 to 6 month mark.
But you would recommend getting help sooner if possible.
I would. I would. I mean,
so
if you can have a therapist, not on call, but like have that relationship with someone just in case. And then, that 4-week mark, 6-week mark comes up and you just want to check in like, hey, can you just assess if this is normal? I would be happy to do that. I would be happy to have a conversation with you and be like, you know what? Everything that you're telling me, I'm not concerned about this. Like, I can help you and we can still talk about some things, but like, I don't think we need to go down any other paths at this point.
Okay. What would those other paths be if they did need extra support? What kinds of things do you help people with, or how do you help people?
Yeah. So for me, individual therapy is what I do for the most part. And during that time, we're going to talk about how are you sleeping? What are your coping mechanisms that have worked in the past? What can we implement now that you have this baby and you might still have some movement restrictions or just time restrictions? Like, what can we fit in there? We're going to look for any patterns. So if we're obsessing over something or we're having a lot of intrusive thoughts, um, we have a lot of modalities of therapy in our toolbox that we can teach. And so my particular style is to pull from a lot of different things. And so we might be doing some thought stopping from CBT. We might be which is cognitive behavioral therapy. We might be pulling a tool from another type of therapy that's radical acceptance. And it's just tailored around exactly what you're dealing with. And that's the kind of therapy that I do.
Yeah. And earlier when you were kind of walking me through some of the things that you do with people, you mentioned things like, I mean, just from the basics, like, okay, how is this affecting you? How is
Yeah.
this affecting you the most? Your daily life. If there are things you can't change, right? There's some things you can change, and the things you can't change. How to learn to tolerate those things better. How to take care of yourself, right? So, and a lot of times when we're in that postpartum period, especially with a mood disorder, we're not thinking about that stuff. And so it can be so valuable to go sit down with someone where that's the full focus and we really just get to dig into that. And that can be very eye opening and
Mm.
very helpful all by itself. Um, but then you probably also support people in maybe looking into medication options, I imagine. I know you don't prescribe, but I know that's something that you are familiar with, right?
Yes. Yeah. So I don't prescribe, but probably 95% of my clients, we will at least have the conversation because I want to make sure that you are making that decision from a place of information and not from a place of fear. A lot of my clients come in and they're like, nope, absolutely will not do medication, not going to do it. I don't want to put anything in my body. Okay, can you tell me more about that? And they have the information that they have, and then I just bring in the information that I have and just make sure I'm just like, I just want you to know that there are psychiatric perinatal nurse practitioners and psychiatrists, and they only work with this population. So they will not prescribe you a medicine that's not going to be safe for you and your baby. They are going to work with you. And if they tell you you don't need a med, great. And if they suggest, then you have that information and you can decide what to do with it. But as long as you understand that there are options out there and you're making this informed decision. That's all I'm asking with the meds, is to just at least take in the information that we are providing to you.
Yeah. I always like to say that I've, known many people who have had postpartum mood disorders, and I've never heard anyone say, "Oh, I regret getting help for that."
Yeah.
Right? Most people say, "I regret not getting help sooner,"
Right.
because medication, therapy, some combination
Mm-hmm.
can just completely change things. And I think it can be hard to get to that point and then think back and go, oh, I could have been enjoying all this time with my baby and all of these things. Relationships could have been enjoying all of this a lot sooner. Um, so not that anybody should have regrets. We get there when we get there, but just knowing that the help can really make things dramatically better.
Mm-hmm. Yeah. And sometimes you don't even realize how bad they are until you've kind of moved through that space and the load has lightened, and you're like looking back like, oh my gosh, how was I surviving that?
Yeah.
Mm-hmm.
Okay. And so the last little thing, do you have any, and we didn't talk about this, so I'm just bringing this on you. How about prevention? Are there any ways to prevent postpartum mood disorders?
That is a question I actually get a lot. I wish there was. There's not anything that we can do to specifically prevent them. We can mitigate, we can like get involved with them sooner. So the more information that you have beforehand, the better. The sooner we see these symptoms come up and the sooner we talk to a provider and the sooner we start getting help, the sooner the symptoms are going to decrease, right? And we're going to kind of get a handle on it. The longer we wait, yeah, it's just, those symptoms are just going to keep going up because that's how your body and your mental health works. Like your body's giving you signals. Something's not right, something's not right, something's not right. And, as moms, we just keep pushing through and keep pushing through until that alert is going off and we can't push through anymore. So, I mean, as with most things, eat a healthy diet and get some movement. We know all of those things are helpful, but just being aware is probably the best thing that we can do if we see those symptoms coming up.
Yeah. Yeah. I mean, I know there are some things that are correlated maybe with lower risk for these
Right.
things, right? Like you said, like eating really well during pregnancy, high protein diets and good nutrition and good sleep, right? So
Yeah.
focusing on good sleep and exercise and even breastfeeding, right? There's some correlation between breastfeeding and lower risk for postpartum depression. And so there are some things out there, but they're mostly just kind of basic self-care stuff.
Yeah. It's things you probably should be doing anyway, to be honest. And the hard part with this is even if you do everything right, it doesn't mean you're not going to get depression, postpartum depression. Even if you don't do any of those things, you might not. And so there are so many other factors that come into play: your family history, your personal mental health history, how your personality deals with change. That's a big one. If you're a person who doesn't deal with change well, this is probably going to be a really hard transition for you. If you're someone who can just like, oh, change, I love change, then this might be really easy for you. So, there's just so many other factors that come into it that even if you do everything you have been told is the right thing to do to prevent a perinatal mood disorder, you might still get one. And that's okay. You didn't do anything wrong. It just is what it is.
And then when you're potentially at higher risk, so, and maybe I missed something, so catch me if I do, but things like if you have a previous, right, if you have been diagnosed with some kind of a mental health condition, like depression or anxiety or bipolar disorder, right? Things like that, that might put you at a higher risk level, which doesn't necessarily mean you will, right? Just at higher risk. I always like to think that if you already have that diagnosis, though, you're probably already managing your care there and you already have a provider. And so that might actually make it a little bit better in some ways.
Fingers crossed.
Yeah.
Yeah. If you already have that diagnosis, because the other thing, like technically on our end, the only difference between like general anxiety outside of pregnancy and postpartum and general anxiety in that perinatal period is the caveat that it happened during that period. So we're still going to write general anxiety disorder within the perinatal period.
Okay.
So yeah, if you had it before, yep, you're probably at higher risk. If your mom, aunt, grandma, if somebody in the family has had anything postpartum, you're at higher risk. So that's why like being aware and just knowing that these things are out there is such a big deal, because then you can keep an eye on those symptoms and be like, wait a minute, I am kind of doing this thing and it is interfering with my daily life.
Yeah. And if you know you might be at higher risk, get yourself a Cheryl.
Get yourself a Cheryl.
Have that phone number ready, right?
Right. And here's the other thing I will say. I am big on the best outcome from therapy comes from the relationship between the therapist and the client. So it doesn't matter what modality I use, what techniques I use, it doesn't matter. If you and I do not have a good relationship, the outcome is not going to be as good. So when people are looking for a therapist, I always recommend interviewing more than one. Most therapists will do like a quick consultation call to see if it's a good fit. We can generally tell pretty quickly if this is going to be a good fit or not, and you can pretty much tell. We're good at reading people. So don't just find the first person that's available. Find someone that you have a really good relationship with. And if you call me and we have a consultation call and it's not a good fit, I'm going to tell you, hey, if I'm not the right fit for you, please email me and I will send you tons of referrals to my colleagues that I highly recommend. And that's the social worker coming out in me, because I can't not do it. I have to get you connected with the person that's right for you. So it might not be me. I know I'm not for everybody. That's okay. But dang it, I'm going to find you the right person.
Okay. Well, I would totally want you to be my therapist, Cheryl. Thank you so much for being here and for sharing so much information. It's been excellent.